You mentioned this earlier about your approach in looking at companies that you don't mind if they take a different approach in solving kind of the same problem. And I'm just curious, how do you know when you look at any healthcare category or any healthcare startup, how do you know what is the right solution to, say, for example, lower the risk of stroke? And what is your approach? Because especially when you look at medical devices or any therapeutic products, there are several ways you could solve the problem. Mm-hmm. And they have all different forms of risk level and effectiveness. And it's how do you approach that? That seems like really difficult.
Yeah, I mean, that's a good question. And to be honest, I don't know that we've asked ourselves, why is this the approach that's going to work? I think it boils down to the mechanism of action of the device. And we have to be convinced that the mechanism of action is solid and makes sense. And it is a solution that is easy to deploy, or relatively easy to deploy. I mean, in cardiology, things are challenging anyway, but that it's relatively easy to deploy. I'll give you an example. We invested in out of University of Minnesota in a company that is developing a solution for what is essentially right heart failure caused by pulmonary hypertension. And it is a very simple, elegant, implantable device that we believe is going to fundamentally change this disease state. There is nothing today out there that actually is curative for this disease state. These patients are going to die once they're diagnosed. It's only a matter of time, whether it's 6 years or 8 years or 10 years. Perhaps you can manage the disease for a while, but there are no cures. And when we saw this, when we first saw it, we said, wow, implantable cardiac device. I mean, that is, as high risk as you can get. But the solution is very elegant, very simple, simple in concept, and makes perfect sense. And then what we do is we go out and talk to all the clinicians that know the disease state, that have studied it, researchers who have studied it. And for any typical investment, we will talk to as many as 10 or 12 clinicians that are experts in their field. And then we run the solution by them. And I remember going out and I met with the head of the pulmonary hypertension division at Brigham and Women's, and he gave me, this is a very busy guy, he gave me 2 hours of his time. He was fascinated with the solution. And, everybody that we met said, well, nobody's thought about this approach before, but it makes perfect sense. This company is called Aria Cardiovascular, by the way. And it makes sense. It should work. And then we looked at their animal data. Earlier I had said, we're looking at the mechanism of action. Does it work in a clinical model? In this case, they had tested it in bovine and cows that are a natural model for this disease state. And it worked. So, we kind of have to take a lot of disparate evidence and put it together and fundamentally review this mechanism of action. Does it make sense? And then there is a risk that it won't work. In the clinic, there's always that risk, but I think we minimize it because of the types of solutions that we invest in.